Hi, thanks for joining Learning to Love Your Logic Model. The origins of this class are my own exasperation at how much people are being dismissive of and attacking logic models. And when you get at what they're attacking, almost always it's a caricature of logic models, not logic models as I've come to know them. And as a result, they tend to do nothing or they tend to do something else that ends up being a logic model under another name. So the purpose of today's webinar is to teach you to love your logic model. What can you get from a standard logic model? And I think by the end of the webinar, you'll learn that most of what you want to do in planning and evaluation can be done using this very simple tool that we're all used to using. Key takeaways today: it's never about the model, it's about understanding your program. When people get dismissive of logic models, sometimes because of their complexity, they often do nothing. I don't care whether you use a logic model or many of the other graphic techniques. The important thing is you need to understand your program if you're going to be successful at planning and evaluation. A second takeaway that we'll go into in a second is that many of the benefits of this are what we call process use benefits. Even though logic models originated in evaluation, sometimes the biggest benefits we bring to the table as evaluators using logic models is helping people clarify up front logical gaps in their program. Some of those are immediately actionable and never turn into evaluation questions. Some of those set up evaluation questions. Number 3, 4, and 5 are related. You know lots about your program even before you draw your model. One of the advantages of logic models is that we often know too much about our program. We have business plans, strategic plans, communication plans, and some of them talk past each other. The simple discipline of a logic model is a way to figure out how do you depict your program and do you depict your program consistently. What that means is, number 4, a little bit of logic modeling goes a long way. Like many things, including some spices, a little bit of this really dresses up the dish, and only a little bit more suddenly makes it overwhelmed with a certain spice. Well, same thing with logic modeling. As a simple technique, you yield a lot of the benefits using the very simplest approaches, and that's how we're going to approach it today. And number 5, why is this important? Because there's a trade-off between accuracy and utility. What a logic model looks like really depends upon who's using it and for what purpose. When we assume automatically that the purpose of logic models is complete, accurate, nook and cranny detection and description of our program, then often what we end up with is logic models that are so complex that it doesn't serve other purposes like communication or engaging stakeholders. So those are the key takeaways we're going to touch on today, and at the end of the class we'll look back and see if we've hit them all. The reason we care about logic models is that all of us are in a continuous quality improvement or continuous program improvement cycle. Most large organizations, and CDC is certainly one of them, do all 3 of these processes: planning, performance measurement, and evaluation. It's not important that the same person or the same part of the organization do all 3 of these. They're all very complicated. But what is important is for them to feed each other. The organizations need to have some common frame of reference. And this is really where logic models excel. So even if someone down the hall is doing planning, someone a floor up is doing performance measurement, and I'm doing the evaluation, if the organization has a very simple logic model at the start, then we can take it in our individual directions, but we'll take it with the same storyline, which means then the evaluation questions I'm asking are the ones that come out of the strategic plan. The performance measures and evaluation yield findings that can then feed back to closing that cycle. What do we do and how do we do it? This is really the underlying intent of the CDC evaluation framework as well. So the framework's about 15 years old, 6 steps starting with engaging stakeholders, but circulating all the way around that circle to ensuring use and sharing lessons learned. Logic models are so important in our framework because they're the way to get the forward momentum to get all the way around that circle. Our circle says good monitoring and evaluation isn't just monitoring and evaluation that collects data correctly, analyzes it correctly. Good monitoring and evaluation, M&E, is evaluation and monitoring where the findings are used. How does that happen? That happens in the focus step by making sure you answer the questions that are really most important for that situation. Both of these are really obvious observations. How do we get there? That's where logic models become so important. Those key steps: engaging stakeholders and then describing the program in sufficient detail to know that everyone has clarity and consensus. You can see how having that clarity and consensus up front is the way to make sure that you have a good discussion about what should we focus on in this evaluation, and you can see how choosing those right questions creates the forward momentum for your findings to turn into findings that are used. Let's start off with the world's simplest definition of logic models. Logic models are graphic depictions of the relationship between your program's activities and your program's intended effects or outcomes or impacts or whatever results term you were brought up to use. I bolded those two words because they're really essential to the definition, and it's what makes logic models different from other things. There are many graphic depictions of all the activities in my program. What makes logic models different is that we don't depict just the activities, but we depict the relationship between the activities and the outcomes. So things like process maps and decision trees, etc., are really, really helpful for complex programs, but they get only at the what of the program. Something becomes a logic model when it tries to depict the relationship between the what and the so what. And that turns to the word intended. When we ask most programs to start thinking about their so what, and particularly to take that so what downstream, it makes them very, very uneasy. This definition of logic models reminds us that what we're depicting is aspirational or intention. It's not the reality and it's not the fantasy. Now, in a class on loving your logic model, it's strange to see this slide that you don't ever need a logic model. You always need a program description, but it's very, very important. There are many people who are turned off by logic models. They've been brutalized by very dogmatic approaches, or they find them overly complicated. As a result, they do nothing. And what they do in the process is they miss all sorts of opportunities to learn about their program in a way that will help them with planning and evaluation. So I try to emphasize here that you don't need a logic model. You don't need any specific type of graphic. You always need a program description, though, to do good planning and evaluation. What does that mean? Well, I think as you go down these 5 bullets that you need to know about your program, you'll conclude by the end that, boy, I really should have a picture. That's going to be the easiest way to do it. But if you're the type of person that doesn't like pictures, tends not to look at maps, then just remember, somehow you need to understand all 5 of these bullets. The big need your program is trying to address. So what's that big lighthouse in the distance? And many programs don't want to think about that because they think the act of putting that in their picture or their description or their logic model means being held accountable for it. We'll see later that's not the truth. And that in fact there's a million reasons you want to know what that lighthouse in the distance is, that big need you're trying to address, even though your program alone isn't going to get there. The second thing is target groups. We need to understand both the target groups, the people who need to take action, and outcomes. Outcomes are the type of actions they need to take. If I was doing this with a corporate audience, it would be a very, very short presentation because almost always in a corporate environment, I'm going to do activity X, Y, and Z, and my outcomes are very, very proximal. They happen almost immediately. Sales go up or they don't go up. Revenues go up or they don't go up. Profits go up or they don't go up. We don't have that luxury in health and human services. Rather, we do something which has to move a whole bunch of people who are not us to do something, which moves a whole bunch of other people who are not them to do something, and that's how we make progress in public health. So those first 3 bullets are essential to program description of any kind, no matter how you do it, because it helps us understand what's that causal landscape, what's that chain of outcomes required to get to that big need we're trying to contribute to solving. Number 4 and 5 finally get to your program. So number 4 says, now that I understand what the so what is and who needs to take those so what actions so public health can happen or public health outcomes can happen, what am I bringing to the table as a program? And then finally, that 5th bullet reminds us that sometimes the biggest process uses come out of not just listing the activities and the outcomes or sequencing the activities and the outcomes, but trying to depict these causal relationships, using boxes and arrows, drawing in something to show the pathways between what I do as a program and who or what outcomes are going to happen first, what are they going to lever, and how's that going to get me to my public health need? Now, I put cause in quotes to remind us that at this point we're aspirational. We may or may not have a theory. We may have a very strong evidence base. Nevertheless, at any point in time, I can say my program description is, if I do these activities, I think activity A will lead to outcome B, which should drive outcome D. Activity B, which should drive outcome B, which should drive which should drive outcome G, right? And that's where a lot of these lessons in process use are going to come from, as we see. Now, logic models can look any way you want them to, and the format that's going to work most appropriately depends totally on the need to which you're putting the logic model. So here's a cartoon of the world's worst logic model. I think it would be very, very rare to conclude that this is the logic model you need. In fact, it's logic models like this that have led to this webinar, because it's logic models like this that people who hate logic models tend to caricature. On the other hand, this is a very, very simple logic model. It includes all of the terms we tend to see in logic models: inputs, activities, outputs, a stream of short-term, intermediate, and long-term outcomes, and then underlying the whole thing, context, assumptions, stage of development. And sometimes this simple logic model is just plenty. We'll see later that even here you do yourself some good by building from the inside out. Here's another simple logic model that we'll look at later, and you'll notice here I haven't used any of those terms: inputs, outputs, etc. I've depicted only activities and outcomes and divided them very simply into early and later activities, early and later outcomes. And we'll see later that for a lot of the uses we put logic models to, this is going to be just fine. Logic models need not even be linear. There was a period of time where it was very popular to have your logic models in circles, and that still survives in some places. I'm a linear guy. I kind of prefer to see them as boxes and arrows, but if it works better for you and your stakeholders to depict it, that's great. You can see in this case, this is a logic model for a policy development. We start with problem identification. We do our policy analysis. We do strategy and policy development. That leads to a whole bunch of outcomes: policy enactment, policy implementation, which gets us to our public health outcomes. Again, we did this as a circle, but it works perfectly well to remind us the steps our program has to go through. Right? The second takeaway is that sometimes the biggest benefits are process use benefits. Logic models, as I said, grew up in the evaluation field as a tool for evaluators and often as a tool for identifying things to measure. What we learned early on is that the big benefit we often bring to this process is clarification with the program early on of the logical gaps and what the program's trying to accomplish, or identifying lack of consensus on those things. So process use, a term often attributed to Michael Patton, means when the influence or the program improvement comes not from the findings of an evaluation, good as they're going to be and helpful as they're going to be down the road, but from these immediate insights you glean during the tasks involved in doing an evaluation. So the identification of stakeholders, the setting of the evaluation focus, those are all early tasks that will often lead to clarity and consensus, or identify lack of clarity and consensus. And most importantly of all, the development of the logic model. So let's look at how logic models help with process use. As I said before, sometimes we know too much about our programs. We have a strategic plan, we may have an evaluation plan, we have a set of performance measures. What logic models do is they hover above those many, many different processes and use a standard set of terms and definitions to dive into your raw material, no matter where it comes from. So I may have a strategic plan full of actions, objectives, and goals, right? Well, by using these terms, outcomes and activities, what and so what, it can help me unravel what's going on in my program. So here's a really good example. So this is a program, a real program at CDC. It has 5 goals, and goal 3 I've called out for the purpose of this exercise: disseminate information to guide policy, practice, and other actions to improve the nation's health. Now let's say that you're a grantee and I tell you the good news about a year in. You know what? By the end of the grant period, if you accomplish goal 3, you're going to get automatically renewed. If you don't accomplish goal 3, you're automatically going to get canceled. Well, as a grantee, you're going to be very excited. I only have to accomplish 1 goal instead of 5 goals. But really, I haven't answered the question of what it means to accomplish goal 3. Logic models to the rescue. And we see that goal 3, when we apply the typical terminology of logic models, activities and outcomes, what and so what, we really see that goal 3 is not one thing, it's a play in 3 acts. Disseminate strong and relevant information, leads to changes in policy, practice, and other actions, leads to improved health outcomes. Now, why is this useful? Because when I tell you as your funder, all you have to do is accomplish goal 3, I haven't told you anything. I've set up a discussion for you to say, and when you say I have to accomplish goal 3, do you mean I need to only show that I disseminated strong and relevant information? Do I need to show, in addition, that relevant information led to changes in policy, practice, and other actions? Or do I indeed need to show that those changes in policy, practice, and other actions led to some sort of improved health outcome? You can see exactly how different the demand on you as a grantee would be. And here, a logic model in very simple fashion, by taking terms like goals and objectives and unraveling them, becomes so helpful. One of the things that turns people off about logic models is all these green and white boxes. Logic models are full of terms because logic models come out of evaluation, which is a hybrid discipline. And so we see a lot of terms in play. Sometimes those terms are used interchangeably, sometimes they're used in different ways. Some of the terms sound alike: outputs versus outcomes, inputs versus outputs, mediators versus moderators, as we'll see later. The reality is that those 8 green and white boxes really boil down to 3 fundamental insights about your program. What the program does, the what, who or what will change because of the program, the outcomes or the so what, and then those last 2 boxes of inputs and context really provide the same insight, although we look at it in slightly different ways, as we'll see. What is it that the program needs beyond what it does as a program? What are the assumptions I'm making beyond what I do as a program that's going to affect my ability to implement my activities in a way that will get my outcomes? Now, as I said before, simple logic models are best, and I always start with a simple model before going into all of these terms. So the good news is, even though I've boiled this down to 3 or 4 boxes, the 2 boxes I want to start with, the 2 boxes that matter most, are the sense of activities. What is it the program and its staff actually do? What we sometimes call the sphere of control. And the outcomes. What are the results of activities? Who or what will change beyond the program if the program does a good job at its activities, or what we call the so what, or sometimes the sphere of influence. So here's the underlying logic of the Communities Putting Prevention to Work program. This was a large program funded by stimulus funds where we gave money to many, many communities in the United States with the intent that they would move the dial on activities and actions that would make a difference in obesity, smoking rates, morbidity, and mortality in the long run. So the money was for 2 years, but the logic model looks aspirationally at everything all the way down to that distal need. What do we learn from that very simple logic model? Well, we learn to have a conversation about sphere of control versus sphere of influence. Where do my activities stop, the things I have control over, and suddenly I'm in outcome land where I'm trying to influence someone who's not me to do something. The second thing that very simple logic model tells us is the sequence of outcomes. What's the order in which I expect these outcomes to occur, and do we all agree on this sequence of outcomes all the way out to that big public health impact we're looking to have? In the model I just showed you, there really is only one pathway depicted, but in other models where there are several pathways, one of the other things I realized quickly is that there's a mismatch of activities and outcomes. I may find that some outcomes don't have any activities to drive them. Some activities tend to go nowhere. They're not related to any big outcomes. The last 2 are the most important uses of logic models that we're going to talk about today. That 4th bullet is what we call the accountable outcome. As I said before, there's a lot of reasons I want you to understand your program all the way down to that distal lighthouse. But the further you get to the lighthouse in your logic model, the more uneasy people get because they fear the act of drawing it is the act of being held accountable for it. No, the accountable outcome discussion is a different discussion that we'll talk a little bit more about later, but the logic model sets up that discussion. How far in this chain of outcomes am I expected to get in the current project period? Am I expected to get ever for this program to be considered worth the investment? right? So let's look at that, and then we'll look at that fifth one, how logic models set up a frame of reference for the rest of your program, right? So I mentioned CPPW before, and I mentioned that it was 2-year money. I mentioned that the logic model that was underlying it was this model, which started off with activities and supports and progressed all the way out to reductions in obesity, smoking rates, morbidity, and mortality. The difficulty with having that logic model out there is it keeps our eye on the prize, but every once in a while you have a stakeholder who thinks that the current effort is going to get us all the way over to the right. Right. Well, this happened on occasion, as it does with all programs. And of course, we could call people back to the logic model and say, remember, this is the long-term journey of CPPW. Our question at the moment is, what can we expect to accomplish in 2 years? Well, in 2 years, we decided that if things went well, we should be able to see that the grantee communities were able to make changes in systems and environments, and that policies changed because of things that they may or may not have been related to, but that a policy environment that was supportive was created as well. Now you can see that solidly on the outcome side, it's just not the outcome called reductions in obesity, smoking rates, morbidity, and mortality. But we had an underlying logic and some modeling and some forecasting that showed that if we could make these changes in 2 years, those changes would then channel behavior changes in the longer run, and those behaviors in turn would channel the reductions on the right-hand side that we were looking for. So the logic model reminds us and reminds stakeholders who are skeptical, yes, we are in the reductions in obesity, smoking rates, morbidity, and mortality business. At year 2, and we're not failing, we're making progress in the right direction if in fact we get to a world where systems, environments, and policies are more supportive. Okay. The next insight we get from a simple logic model, besides these obvious ones of sphere of control, sequencing of outcomes, mismatch of activities, and now the accountable outcome, is that the logic model sets up a frame of reference for more detailed models. When I work with an organization, I always say, look, if you can only do one model, start off with the big, bold, overall model for the entire effort. Even if you can have multiple models, start at the top and work your way down instead of inducting from the bottom up. What starting at the top does is it allows us to lay out in big, bold strokes what the purpose of the program is. I can then dispatch everyone who's in any part of the program and say, now you do your own logic model, but each logic model is built with reference to the levels above and the levels below. And why would I know that? Because I would see as I progress through these models, I'd see that that right-hand side of each model is something that I saw in the big model. I'd see that on the left-hand side of every model, I see 1 or 2 clusters that I saw in the big model. So, having laid out all of these opportunities for logic models in all these different formats, how do we get there? So let's talk a little bit about activities and outcomes and how to create a simple logic model from them. There are 3 big ways to construct logic models, and which one's going to work for you depends totally on the purpose for which you're drawing the logic model. I would say in my work at CDC, which spans now a couple decades, almost all of what I do is method 1. Almost always I know something about the program. The program may exist, it may just be in the planning stages, but I know enough about the program, even if it comes from a mission or a vision or a business plan or a communication plan, such that I can look at this material and say, what sounds like what the program is going to do, the what sounds like who or what is supposed to change because of the program, the so what. There are other occasions, though, where numbers 2 and numbers 3 are a little bit more helpful. So number 2 says, I'm really in a formative phase. I know the destination I'm trying to get to. I'm really not sure how to get there. Well, then the purpose of the logic model is to start on the right with the destination in mind, and you keep backing up and saying, well, how do I get there? How do I get there? How do I get there? This sounds like it's going to be a really, really simple process, but in fact, it becomes very, very complex, very, very messy. But if I then impose those 2 lenses on that mess, what part of what I just laid out here is something I'm going to do as a program? What part of this is the way in which people who are not me are going to change so that public health can happen? Then I'm back to the same kind of logic modeling raw material that I am in method 1. Method 3 works best when you've got small programs that don't see themselves as part of the larger picture, but need to. So I work a lot with community-based organizations, and sometimes I'll do pro bono consulting. A small community organization will always have a very, very good sense of its what, often in excruciating detail, but they'll have very little sense of so what. They'll have one or two very stubby outcomes. Well, for reasons of strategic planning, performance measurement, etc., you really want a better sense of that so what, and so there the action is to move them out from their outcomes and say, so what, then what happens? So what, then what happens? So what, then what happens? Until we get closer to a thing that looks like the big distal lighthouse in the distance. What I do then is I have my two columns, and sometimes the easiest way to create a logic model is just to say, without adding anything, what if I took that column of activities and divided it into two? Are there ways to sequence these activities based on the logical occurrence? Do some of these activities have to happen before other activities can happen? Sometimes yes, sometimes no. Even very, very complicated programs often will have activities that roll out over time but are not logically connected. They're logically independent. On the outcome side, one really, really big benefit of logic models, as we said before, is the sequencing of these outcomes. I may start off with one column of outcomes, 10 outcomes in there. It is invariably the case that if I give myself 2 columns or 3 columns to play with, that I can answer the question and figure out if everyone answers the question the same way, which of these outcomes is going to happen first, thus leveraging the later outcomes, thus leveraging those last outcomes, which look very much like our need. So I'm going to walk through a very, very simple case that we're going to use for illustration purposes. And for people who've taken classes with me at CDC, this is a case I've used over the years. I've doctored it up to make teaching points. At one point way in the midst of history, it represented how we did lead poisoning. These days it does not, since we have more of a primary prevention focus. But I retain this case because I've been able to embed some minefields in it that help the teaching of these logic model points. So let's kind of read through this together. County X, with a high number of lead-poisoned children, has received money from CDC to support its childhood lead poisoning prevention program. All right, that's obviously just preamble. The rest of this, I want you to pay attention as we read to what sounds like that big lighthouse in the distance need, what sounds like what the program is going to do, its activities or its what sounds like the outcomes it's trying to achieve or to influence. The so what, who or what is going to change if the program does a good job at its activities, right? The program aims to do outreach and identify children to screen and identify those with elevated blood lead levels, assess their environments for sources of lead, and case manage both their medical treatment and the correction of their environment. They will also train families of elevated blood lead children in selected housekeeping and nutritional practices. While as a grantee, they can assure medical treatment and reduction of lead in the home environment, the grant cannot directly pay for medical care or for renovation of those homes. So a simple case, I've laid it out in one slide. Obviously, it's more complex than that, but this slide is complex enough for me to extract from that, what does my 2-column table look like? What does this program do? Who or what is this program trying to change? If I had you in class, you would do this yourself, but I bet we'd land in about the same place. What does the program do? It does outreach. It uses that outreach to figure out where to screen. It does some case management. Notice I haven't listed these in the order in which they occur. I've listed these just in a free-floating order, which is fine right now. They do referral for medical treatment. They identify the kids with elevated lead. They do environmental assessment of the home. They refer the firemen for environmental cleanup if it needs it, and they do family training. On the outcome side, I was trying to depict boldly who or what are we trying to move that's not us. And there are 3 whos or whats we're trying to move. We need to change families. We need them to adopt the in-home techniques our training teaches them, and we don't own the families. The families are independent actors. Providers are definitely independent actors. They're not part of our program, yet we need them to treat the EBLL kids that we find and or to refer the kids that they find. The landlord or the housing authority, they're really so important to us because that's how we eliminate the lead source, because we can only refer for medical treatment, we can only refer for environmental cleanup. And then those italicized ones at the bottom, those look pretty much like my lighthouse in the distance. Get that EBLL down, which is what the literature says is going to stop a developmental slide, presumably improving the quality of life. Now, I learned a few things from even this two-column table, but I don't want to go into those here. I want to show instead how much we learn when we simply expand this to 4 columns. So here's that same two-column table expanded into 4 columns. And all I've done is I've asked myself, in that list of activities, which ones fundamentally need to happen first to drive the later activities. On the outcome side, you can see on that right-hand side, this looks pretty much like the downstream need, the distal lighthouse in the distance. So that early outcomes column is, what are the things I expect to see earlier in the project period that are going to drive me down to that right-hand column. Now, as I said before, sometimes there's a lot of process use insights that come even from those 2 columns and from those 4 columns. But the real process use insights, and when we do strategic planning using logic models, I almost always drive to this next approach, is to take that 4-column table, start drawing in some boxes and arrows to lay out what some people would call the theory of change, some people would just call a logic model, some people would call a flowchart format logic model. But the important thing is, no matter what you call it, to remember that the arrows you're putting in there, which I'm calling causal arrows, are not cause in the sense of scientific theory. They're cause in the sense of what's the underlying logic of the program. Based on what we know today, what do we think that underlying logic is? The second thing to remember is this is not a different logic model. It's just the same elements in a different format. So if the 4-column table is the MapQuest directions and narrative, then this is the MapQuest map. The arrows are therefore going to go from activities to other activities. Some are going to go from activities to outcomes, and some are going to go from those early effects or outcomes to later outcomes. So again, remember, we're going to see all kinds of arrows in here. They're going to play different roles. So here's our 4-column table reformatted as what I call a causal roadmap, but that's just a term that I made up. Right? So you can see here that I haven't added anything. I might have changed a few of the terms so that they fit into the box. You can see that column 1 looks very much like column 1 in the 4-column table. We do outreach, which leads to screening, which IDs the kids. We then put the kids with elevated blood lead into case management. That leads to 3 pathways that proceed to the east that get me over to reducing elevated blood leads, which then leads to what the literature shows. Not necessarily improved development, but at least stopping the developmental slide and more productive and or quality lives. What do I gain from having done this? Well, I gain a million different things, but let me point out 2 or 3 key process use insights. So let's say that I told you I was going to make a bet with you, and that bet is if you get to reducing those EBLLs, so that second box in on the main pathway, if you get there at the end of 3 years, I'm going to double your grant. If you don't get there, I'm going to dock your grant. If I frame that bet and I tell you, looking at this logic model, if that logic model is a correct depiction of the program, why would you not take on the bet? I bet you your eye will be immediately drawn to 2 or 3 things, and these 2 or 3 things are not observations you might necessarily get from that 4-column table. So why should I not take on this bet? And again, you may choose to take on the bet, but I'm going to guess that if you're a risk-averse person and you know this program and you think this is an accurate depiction of the program, a couple things are going to scare you from hitching your wagon to that reducing EBLL star. The first one is, look how few of the outcomes are under your look how many of the outcomes, or how few of the outcomes, are from things you have direct control over. You're dependent upon the kindness of strangers for all 3 of those pathways. I can do environmental assessment. That doesn't guarantee someone's going to clean up the environment. I can train families. That doesn't guarantee they're going to perform the techniques. I can refer for medical treatment. It doesn't guarantee that the person I refer to will actually conduct medical management. So the first thing I worry about is that there's quite a bit of distance from my accountable outcome, and that's easy in this case. It's where I'm going to cash in, get those blood leads down and keep them down. There's quite a bit of distance between where my control ends and that accountable outcome. A second insight I get from this model that I might not get from the 4 columns is look to the left of that box that says reducing EBLLs. You'll see an arrow there, and that arrow shows 3 pathways collapsing into one pathway. Now, I've been very, very vague about what that one arrow means at this point, but it could mean that every one of these pathways is an independent way of getting the blood lead down. If that were the case, I might take on the bet. I mean, if I have 3 ways up the mountain, they're not all going to be washed out at the same time. I might be able to get there. Or it could mean that those 3 pathways all have to occur to get that blood lead down and keep it down. And if you know anything about lead poisoning, it's much closer to the latter. So a second reason I don't want to take on this bet, and this is something I might not see in my 4 columns, is, holy mackerel, for me to get the blood leads down and keep it down, I have to depend upon the kindness of 3 sets of strangers, and those 3 sets of strangers need to head east, and they all need to head east at about the same pace so that the blood lead can be reduced and I can keep that blood lead reduction down. The final thing I might learn from this that I wouldn't learn from the 4-column table is if I were to ask you what looks like the hardest job in this organization. Well, if you're not used to doing lead poisoning or this type of program, you may think all of these things are hard, and certainly they all come with their challenges. But look over in column 1, look at poor case management. The first 3 activities preceding case management just pancake down. Nothing heads us east towards outcomes until we get to case management. And then that poor case manager is responsible for these 3 very different pathways. Right? Now, what does this tell us? It tells us a few things that are helpful immediately for process use and a couple of things that are very helpful for us as evaluators creating measures. In the process use sense, doing this instead of the 4-column table immediately tells us, look, I'm worried about this program because it's just getting implemented. As the implementer or the designer or the planner, I'm going to worry about things. I'm going to wake up in the middle of the night thinking about this program. But I know really where to direct my anxiety thanks to this logic model and thanks to this bet discussion. I know that of all the things I'm going to worry about, the things that are most going to put me in a ditch are the failure to have those handoffs between column 2 and column 3, the failure of those handoffs to lead to concurrent and active and effective performance by my 3 classes of partners, people cleaning up the lead source, the families performing the techniques, and the doctors doing medical management. And thirdly, it's going to depend upon how good I am at finding these superhuman case managers. Right? So those are immediate process use insights. They say if I want to make sure this program gets out of the barn and looks strong and ready to survive, I have to address those 3 things and address them now. As evaluators, we're looking at where the program planner feels queasy as we go through this exercise, and we're noting to ourselves immediately we need to be paying attention to measurement of that above all else. So what are the things I'm going to measure? I'm going to measure, did in fact those handoffs between column 2 and column 3 happen? Did in fact the concurrency of those 3 pathways happen so that the blood lead went down and stayed down? And did in fact the program find the superhuman case managers who could take and cover this span of environmental assessment, training families, referring for medical treatment? Let me go through one more quick example which will feed into some of the elaboration we're going to do a little bit later. So those of you who have been at CDC or familiar with CDC for a long time may remember the Office of Workforce and Career Development, OWCD. It's where the training was housed and a whole bunch of other activities. I mean, one of my many jobs at CDC, or one of my many places that I worked from on evaluation at CDC, OWCD was one of them. And I came in just as we were developing a strategic plan, and this was the mission statement that we were starting with. To improve health outcomes by developing a competent, sustainable, and diverse public health workforce through evidence-based training, career and leadership development, and strategic workforce planning. Now let's read that again, but again, looking through the lens of a logic model. What in here sounds like the need? What in here sounds like what the program itself is going to do? And what in here sounds like the so what? Who or what that's not the program is going to change? To improve health outcomes by developing a competent, sustainable, and diverse public health workforce through evidence-based training, career and leadership development, and strategic workforce planning. Right. Now, if I had you in class, we would sit down and do this as an exercise, and I bet you this is where we'd land. What's the need? Improving health outcomes. What are the activities? Conducting training, doing career leadership development, doing strategic workforce planning. What does that lead to? What's the big so what? A whole bunch of people called the public health workforce become more competent, more sustainable, and more diverse. They may become better in a million other ways as well, but the mission statement says, gosh, the big fish we're trying to fry is to improve their competency, their sustainability, and their diversity. Now, one little wrinkle here, this word evidence-based. So if you read that mission statement, you assume that it's only 30 words. Every word needs to mean something. Then when I came to the word evidence-based, I really had two choices. Most of you probably assume that the evidence base was embedded in the training, the leadership development, and the strategic workforce planning, meaning that evidence base exists, and I'm going to make sure I draw on that evidence base when I try to conduct my activities, and that's why I'm going to get to a competent, sustainable, and diverse workforce. Conversely, the question would be, but gosh, what if that evidence base doesn't exist? At this point, what I want to ask myself is, does it matter? So I'm in the strategic planning business. I have this mission statement. I just went through this simple logic modeling exercise. I come up with this question about evidence base. Does it matter or not? Well, the question is, do I need to know as an organization if that evidence base exists ahead of time, or if that evidence base is something I have to create? And the answer is yes, I absolutely positively have to know that. There's a big process use insight. If that evidence base is something I have to create, then that evidence base moves from a red box under inputs over to another green outcome box called really strong evidence base, which emanates from a whole bunch of activities that are not currently in the logic model, which require staff and require money. So this life in 3 boxes simple logic model helps me identify up front a really, really important question I need to resolve for my program. So let me conclude this section by saying simple is best. Always start with these simple logic models, sometimes activities and outcomes, and the sequencing of the activities and outcomes is just plenty. Nevertheless, we deal with all these other terms, and they do exist, and so I want to go through why do evaluators and evaluation logic models have so many terms, and when should you use those terms, and how can you use those terms to maximum advantage. So the terms we're going to look at are the ones that I deal with most commonly in my own work: mediators and moderators, outputs and inputs. But always remember, as we go through this explanation, form follows function. Not all models need to have or have all of these terms, and even when you use these terms, there's ways to use them that will benefit you and ways to use them that just means you're going to create logic model fatigue for the people you're working with. So let's start off with mediators. Mediators are a very confusing term because it sounds a lot like intermediate outcomes. Mediator just means stuff that comes between other stuff. So here's a famous cartoon you've probably all seen that depicts the concept of mediators or mediation. Famous scientists, step 1, step 2, a miracle occurs, step 3, step 4, result, etc. And the caption is, I think you should be more explicit here in step 2. Well, that's really what mediators are about. They're not about the things that are miraculous, meaning we need a divine intervention to accomplish our public health outcomes. It means the place where we have a gap in logic. We're not really clear on how we get from step 1 to step 2 to step 3 to step 4. And this is where mediators help us. And sometimes we need them, and sometimes we don't. Sometimes our logic models are very explicit, and they don't really require any mediator elaboration. Other times they're not. So let's go back to the example we just left with OWCD. So here's the very, very simple implicit logic model that we came up with from their 30-word mission statement. Do they need a mediator? They don't need a mediator necessarily if one of 2 conditions is present. Condition 1 says, I don't need a mediator if it turns out I can show pretty significantly that my activities lead to that distal outcome. So if I can show as OWCD that the training, leadership development, and workforce planning I do leads to improved health outcomes, well, I don't need a whole bunch of mediators. Who cares how I get there? God bless me for doing that good work. I'm going to guess that in this case, that everybody in OWCD was very, very restive and uneasy about putting improved health outcomes in there because, gosh darn it, improved health outcomes comes from a million different things. We're just one piece of the puzzle. Our ship is so small and that sea is so large. Do they need a mediator? Not necessarily. They still don't need a mediator if it turns out the thing they can achieve, that accountable outcome that they feel most strongly and confident about, is one that people would buy as a good in its own right. So OWCD doesn't need a mediator if when they tell people that what they produce is a competent, sustainable, and diverse workforce, everyone claps them on the back and says, man, thank you for a job well done. A grateful nation thanks you for your service. Now, a decade ago, I would say they didn't need a mediator. People had much more faith in government. They had much more faith in the efficacy of government expenditures. They had much more faith in the efficiency of government efforts, such that in an OWCD elevator speech, if I said, I do all this good stuff, and as a result, the public health workforce is more competent, sustainable, and diverse, and a story, I'm doing good work. I think in the ensuing decade, that's all changed. And I don't think that's going to buy you much more. So OWCD needs a mediator. Why? They cannot prove that their activities lead directly to an improved health outcome. And the outcome that they can show with near certainty, competent, sustainable, and diverse workforce, doesn't sell the program to the people that matter, the people who care about it, like Congress, the public, etc. So how do we get to that mediator? Remember, mediators means things that come between other things. In this case, that mediator space is obviously going to be some outcome yet to be named between that proximal outcome, the workforce is more competent, sustainable, and diverse, and that distal outcome, improved health outcomes. So what I'm looking for in my mediator is, okay, what's so gosh darn good about competency? What's the so what of a competent workforce? What's going to come from a competent workforce that while it's not improving health outcomes itself, it's clearly going to be a much more important driver of health outcomes? What's so good about having a sustainable workforce, one that isn't constantly marred with attrition and or has a deep bench? Why is that so good? Not because it improves health outcomes, but it drives something that gets us much closer to improving health outcomes. Same thing with diversity. Why is a diverse workforce so much better than a homogeneous workforce? What's the so what of that? Now, there's a good literature on a lot of these things, and at this point you would obviously draw on that literature. But the reality is sometimes you're operating just from practice wisdom, and even there, this is still going to be a helpful exercise for you framing what is it that's going to come from that outcome I've listed? What's that next set of outcomes that I want to measure, I want to sell, because that's what's going to persuade skeptics this was worth investing in. So if I had this in class, we'd spend some time doing this, but I bet you this is where we'd land. If my workforce is more competent, programs are going to be more effective. People are going to know what programs work, and they're going to deliver them in the right way. All right. That's not improving health outcomes, but if I tell someone in an elevator speech that I produced a competent workforce, they may yawn. If I say, because my work produces a competent workforce, you can guarantee that those programs delivered at front line are the most effective programs we know will be effective. That's going to buy me more. What's so good about sustainability? Who cares? It could be that people hate sustainability. It just means that you're paying all of these public health workers forever and ever to sit around doing nothing. Well, again, if the course of sustainability is continuity in relationships and approach, I know over the years which people in town are most important to reach this population. I know over the years which people in town are most effective for funding. I don't waste a whole lot of time training people and retraining people because I'm constantly dealing with churn. Well, that's not the same as improving health outcomes, but a person would plausibly say, if that's what sustainability means and produces, that's something worth buying. Then finally, diversity. I mean, diversity above and beyond anything else is probably cultural competency. And there's a huge literature showing that if I want clients to access and adhere to the program, if I want clients to trust the information I'm giving them, if I want clients to trust me enough they'll even come in to disclose their problem, then that's going to be a good benefit of a diverse workforce. That's not the same as improving health outcomes, but obviously a plausible person is going to say, oh my gosh, if the client's coming in, they're actually accessing the program and they're adhering to the recommendations, I have a good shot at getting health outcomes improved. So this is an advantage of mediators. Right? Remember before when we talked about CPPW, CPPW was a great logic model. It took us all the way out to that eye on the prize, reductions in obesity, smoking rates, morbidity, and mortality, because we were investing a ton of money in several communities that would then implement certain activities and supports. The trouble with leaving this logic model where it is it leads people to erroneously believe that the program is not successful unless we see those reductions. And again, CPPW, as part of the stimulus, was really intended for an investment of about 2 years. So here, if this is what we started with, then everything in that middle is a mediator. And that whole logic model, all those boxes we saw before, if they didn't exist ahead of time, would need to be created to help explain to other people our eye is on the prize, but what do we expect to happen between the implementation of activities and supports and that reduction in morbidity and mortality? And you can remember, from what we said before, we expect the activities and supports we've chosen to drive these communities in a way where they'll see accomplishments in their systems and environments and the policies that underlie them. Those are changes that the literature shows and forecasting shows will channel important behaviors and important protective behaviors that lead to these reductions. Right. So in that case, the mediator saves us from the day when someone says, how come people aren't thinner? How come people aren't smoking less? You say, look, because we're only in year 2, and this is a model of environmental and system change to drive behavior, and you can see how those changes relate to this ultimate goal, and that's where we are at year 2. So at this point, what we've elaborated is the outcome side of the logic model. And sometimes we need to, and sometimes we don't. Sometimes we can get by with a very high-level list of outcomes. Sometimes we need a much more complex or detailed list of outcomes. Once we've got that outcome chain laid out in more specificity, then the question turns to, how do we do our activities in a way to achieve those outcomes, and especially those outcomes that we're calling accountable outcomes, the ones that we're responsible for in a certain project period or responsible for at a certain point in time. And this is where the second term we want to elaborate comes in. That term is outputs. Now, outputs is the most confusing term in the field of evaluation because it sounds almost like outcomes, and for people who don't confuse it with outcomes, they confuse it with inputs. I tended not to use outputs in my own work, and often I don't disclose them even still in my logic models. But I've been persuaded that the output discussion, what outputs bring to the table as a discussion, is incredibly valuable for logic models and for programs, whether you're thinking about evaluation or you're thinking about strategic planning. So let me show you how outputs help and how to use them in the right way so that you'll derive the maximum benefit from them. So here's a logic model for almost any screening program. And so this looks very much like our lead screening program. Outreach leads to screening, leads to identifying people with the condition. I've only depicted a couple pathways here. One is I can train people with the condition in self-management. One is I can refer them for medical treatment. The self-management will lead to a protective behavior change. The medical treatment will lead to medical management of their problem, both of which contribute to improved health outcomes. Right? So this is fine, very straightforward. If I was looking for outputs, the traditional outputs that I usually see, and one of the reasons I don't care for outputs or did not care for outputs, is this. It's all the big activities, screening, training, and referrals, repeated in the output column with a number sign in front of it. Now, there's nothing wrong with that. If I give you a bunch of money, I want you to understand you have to do non-zero numbers of screenings, non-zero numbers of trainings, non-zero number of referrals. But in terms of the logic model depicting anything that's useful for driving me as a program, either in a process use sense or in a measurement sense, that output column is pretty useless if all it's going to do is count things. So my friends that love outputs and are very persuaded at the utility of outputs for helping programs get better say, no, you're looking at things incorrectly. What the logic model helps you do is to understand how you need to do an activity. And why? Because the logic model makes clear what's supposed to result from that activity. So whereas before I was counting the number of screens I did, the number of trainings I did, the number of referrals I did, the plot thickens when I use logic models as a way to elaborate my outputs. So it's not just the number of screenings I did, it's I want to know the attributes of screening that will make that screening so good it will lead to identifying people with the condition. In the logic model, it's very clear. I'm in the screening business not to screen as many people as possible, but to identify people with the condition. I'm not training in self-management as many people as possible. I'm doing that training in a way that it will lead to the protective behavior change that I want people to adopt and sustain. I'm not referring for medical treatment for the sake of issuing as many referrals as possible. I want to refer in such a way that referral, sure as shooting, is going to lead to someone entering and completing quality medical management. You can see how much more helpful this is going to be to a program, both prospectively and retrospectively. As people planning and implementing a program, what I want to learn from this is potential sticker shock. How was I going to screen? Well, now that I know that screening isn't its own thing, it's a thing to identify people with the condition, I may realize that the screening I'm doing is going to be exactly the wrong kind of screening, either in the wrong place, with the wrong level of intensity, or whatever. The same thing, obviously, with training. There's a huge literature on how we actually get results from training. And it could be that the way I was going to train might have been handing out a manual, but this is a very, very complicated behavior change. Now that I realize I need to be in a training business to get behavior change, I may have to change my whole training. And the same thing with referral. How I refer may change when I realize, holy mackerel, my goal is to get a whole bunch of people with complicated lives referred in a way that they'll actually get and retain and complete quality medical management. So those are all process use insights, things the program can do right away. Retrospectively, as the evaluator, I'm listening to this and I'm saying, you know, I've just come up with my process measures. Outputs, the output discussion, its major benefit for us as evaluators is to help us create good process measures. Process measures down the road are going to be those measures that tell us, did the program get implemented like it should have? Did it get implemented according to its gold standard? Well, what's the gold standard for a program? It's a program implemented so well, doggone it, it's going to achieve its outcomes, or it's going to achieve the next thing the logic model says that activity is supposed to lead to. That's exactly the discussion we've had on the output side. And here we go. So if I had you in class, we'd spend a lot of time discussing this, but here's where we'd land. And notice that I've retained this idea of counting things. So it's fine to count how many kids did I screen, how many clients did I train, how many referrals did I make. But you can see in the parentheses that I've tried to call out the things that are most essential to that screening. So in the case of lead, it's great to know I screened 1,000 kids, but what's really going to help me get to identification of kids with lead poisoning is that I do those screenings in the areas of town that meet a likely risk profile. I might give money to 10 different cities. They may all say they screened 1,000 kids. I may find out down the road that of those 1,000 kids, in cities 1 through 5, they found 10 kids. In cities 6 through 10, they found 500 kids. Well, almost always, that's what I want to capture in the output. How can I predetermine by looking at how people are doing their screening that these folks are doing it in a way that's going to lead to identification of kids with lead poisoning? These people are really wasting their time and they're wasting their money. On training, sure, it's great to train as many clients as possible, but using a culturally competent curriculum and appropriate supports is probably what's going to distinguish people who just report they trained 200 people from people who report that they trained 200 people and 6 months later, those folks were maintaining the behaviors that they learned in the training. Referrals, sure, it's great to refer as many people as possible, but will that referral lead to completion and entry into medical treatment? Only if I'm referring in advance to qualified or willing medical treatment providers. Now, sometimes this isn't an issue, but with something like lead poisoning, it really is. Not everyone knows how to do it, and a lot of people who know how to do it don't want to take on still one more poor, uninsured, or Medicaid kid. So Outputs lives in this land between the activities and supports and that first set of outcomes. So I'm not asking myself now in CPPW, what activities and supports should I be undertaking that will lead to reduction in morbidity and mortality? That may be a 5-year, 7-year, 10-year journey, and I may have forecasting and modeling to determine when that's going to happen and how it's going to happen. Rather, the question the outputs have to ask is, now that I know what's supposed to result in the short term, especially the short and mid-term, even a little bit later, how do I do my activities and supports in a way that's going to make that happen? And it could be I'm on the right track and it's no problem. It could be I have massive changes to make in the way I approach things. Okay. The final thing I want to talk about is inputs and moderators. Remember I said at the beginning that there are two other elements and insights we get about our program, and those elements and insights are, what are we depending upon from the larger environment? We call those inputs and moderators, but the role they play in our discussion, as we'll see, is pretty similar. What's going on in that larger environment outside my program about which I'm making assumptions? And if those assumptions are wrong, it's really dumb to continue with the program. Now, it's very easy to fall into the trap of listing every input and every single moderator. We'll see in a second that what we're really looking for is cutting to the chase for what we call killer assumptions. Assumptions we're making that if they're not true, it's very silly to continue with the program. The program can't achieve its outcomes no matter how good the implementation is. So these live in two places. They live in that resource platform that we call inputs that we talked about a little bit before, and they live in this external environment that we call moderators or context or situation or whatever. But in both cases, we're talking about things going on in that environment over which, by definition, we don't have much control. This is the outside environment, but yet on which we're dependent because the presence of something is either going to accelerate or it's going to hinder the ability of our activities to turn into our outcomes. What that really does is it elaborates our program logic. So heretofore, what we've talked about is a program logic that says if leads to then. If I do these activities, I'll get these outcomes. When we talked about mediators, we fleshed out the then side. Holy mackerel, maybe I don't want to just have two outcomes depicted. Maybe that chain has 3, 4, or 5 outcomes, and that helps me understand better what I'm accountable for. On the if side, we said, gosh, we need to do these activities well enough to achieve those accountable outcomes. Well, that's what the output discussion was about. The output discussion said, how do I do this if? How do I do the what of my program in a way that's going to enhance the chances I'll get the then? All of that's good, and all of that are incredible process use learnings. But the reality for a lot of programs is not if then, it's if and then. If I do my activities as well as I intend and the outside environment cooperates, then I can get my outcomes. And that's where inputs and moderators are so helpful to the discussion. So inputs live to the left of the logic model. They're the resource platform on which I mount my activities and supports. Moderators live underneath the program. At any point in time, it could be that big secular factors are going to keep my activities from turning into my outcomes, or my first outcomes from turning into my midterm and my long-term outcomes. Let's go through inputs first. Again, you can list every input necessary for your program. I don't think that's going to help you as much in loving your logic model as thinking through big classes of inputs and seeing which inputs make you a little bit uneasy or a little bit queasy. So again, this is a lead poisoning program or a standard screening program. Let's think about lead poisoning in this case. 4 classes of inputs that are very common. Did I get the money I needed? Did I get the staff I needed? Do I have the legal authority to do what I want to do? And then relationships for medical treatment. In this case, I bolded relationships for medical treatment because I think while all 4 of these are very important inputs, the relationships for medical treatment is the one that constitutes almost a killer assumption. Remember, in our causal roadmap for lead poisoning, that I couldn't do environmental assessment. I couldn't clean up the environment, and I couldn't I couldn't do medical management. All I could do was refer for those things. Well, that's a great answer. That's a great way to say, how am I going to get reduction of elevated blood leads? But it makes the assumption that I have those relationships in the first place. If not, it's a killer assumption. The program simply can't be achieved if I don't have anyone to refer to, or if my referrals land on barren soil. What do I do with that as an observation? What do I do with that as an observation prospectively, and what do I do with that as an observation retrospectively? Prospectively, what I understand is, holy mackerel, this program is not yet out of the box, and I feel very uneasy about those relationships. Well, remember early on with OWCD, did the evidence base exist? If not, it was something we had to create. Well, same thing here. Why would I initiate this program knowing full well I'm going to do all these referrals and they're going to go nowhere, and that I'm not going to be able to clean up the house or clean up the kid, the only two levers I really have for getting the blood lead down? What I would do is I would stop and ask myself, should relationships be an input, or should the creation of relationships be a really key activity that I move over to the left into the logic model? Retrospectively, as an evaluator, I'm listening carefully. What are the things that are going to drive this program into a ditch? And it's going to be very clear from this discussion that the failure to get those relationships is going to be the thing that's going to sink the program. The existence of those relationships is going to be something that's really going to accelerate the progress. That immediately then tells me this needs to become one of my evaluation measures. This needs to become one of my focal evaluation questions. Just like we say that firefighters run to the fire, not away from it, logic model builders and the evaluators who use these logic models run to the inputs. They run to the killer assumption, because if it's a killer assumption, I'm not going to get my outcomes. I can go back to the stakeholder, back to the staff and say, gosh, you didn't get your outcomes. I don't know why. You just had such great outputs. Or I can say, you didn't get your outcomes despite your great outputs because you failed to take into account a few of these factors in the outside environment that were killer assumptions. In this case, a missing input called strong relationships. Now, moderators does exactly the same thing, but it's writ large. So the inputs are often things we know of in our daily environment, or if we don't control them, but we kind of know who does control them. I don't have my own money, but I know who to get it from. I don't have my own staff, but I know the folks in HR. I don't have the relationships, but I know the people in town I need to develop relationships with. Right? Moderators are a little bit different. They're the big, bold, secular factors that either get in our way or accelerate change. And they're so common and they're such a problem for most program implementation that there's actually a name for them called a PEST analysis. And PEST stands for political, economic, social, and technological. These are the four classes of outside moderating factors, the four elements of context that can either get in our way or accelerate our progress. And political doesn't necessarily mean Democrat or Republican. It could just mean something as simple as the relationships among the different agencies in town, the relationship between the government of a city and what the private sector and the Chamber of Commerce thinks of them. Economic could mean a global meltdown. It may mean as much who has enough money to buy cable if I'm doing a communication intervention. Social is the one we're most used to. If I'm trying to reach audience X, what are their cultural norms? What are their language norms, etc.? So let's use lead poisoning as an example for what moderators might look like and what we yield from this discussion. So at the bottom in this box, I've listed three very common moderators, meaning if you implement lead poisoning programs across the country, you find that people are making progress on their outputs, but they're not all getting their outcomes. Invariably, something going on in that moderator territory is probably to blame. Hazard politics means to what degree does anybody in authority care about lead versus toxic mold versus asbestos? So we call that hazard politics. Health insurance coverage. Lead poisoning afflicts primarily really poor kids in inner cities. Some of them will have Medicaid, some of them will be uninsured. Both of those factors will make it very, very hard often to find a doctor that wants to take on their case. And the third one is availability of new technology. We have to confirm lead poisoning in fairly detailed ways by drawing a capillary blood draw or a finger stick and then confirming it with a venous stick of a very little kid. And a lot of moms and dads will just say, gosh, I'm not sure I want to put my kid through that. Yet new technology that allows you to do it in one step, just like you would test your glucose levels if you were diabetic, ends all of that. It makes it so much easier, but it's very expensive. So here's three things not in my control: the hazard politics in my town, the health insurance coverage in my state, the ability of my funding to support this expensive new technology, which the presence or absence of may define totally how much I get blood leads down and keep them down, despite the fact I'm doing just a bang-up job on my outputs for all of my activities. What do I do with this observation? Well, I do one of two things. In this format here, which is the traditional way I used to deal with moderators or context, it's what I call the box of shame. It's all the reasons that I'm not going to get these outcomes. So don't look to me to get that blood let down, because how can I be expected to make progress when there's hazard politics, health insurance coverage, availability of new technology? Well, my friends who are big on this discussion of elaboration of inputs and moderators would say exactly the opposite. They would say, no, you want to identify those outside factors. Then what you want to do is you want to map them to your logic model. And the act of mapping them reminds you that these outside factors don't necessarily sync the entire program. What they do in a multi-pathway program is they may sync one pathway but not another. Well, that gives you some opportunities perhaps to ask yourself, can I get up the mountain knowing that the northern pathway is out? Can I get up the mountain by using only that central pathway? So we see that hazard politics certainly is bad, but it kills mainly that northern route. I can refer to Doomsday. The lead source won't get removed until the town has dealt with toxic mold and asbestos. Insurance climate is really bad. It essentially kills that pathway. I can refer for medical treatment as much as I want. There's no one in town that wants to take on another uninsured kid. The technology doesn't kill the whole program, but it does kill the ability of screening to identify those kids with EBLL in a quick and efficient fashion. Now, lead's not the best example of this because we said before the nature of this program is such that all three pathways have to happen and happen concurrently. But you can see in a program with multiple pathways where that wasn't the case, knowing, boy, oh boy, I can think of some things I can do as a program to improve insurance climate and to buy that new technology. And then I can think of a way to scale this program and to target this program that even though the hazard politics are not in my favor, I can make it over to reducing elevated blood leads. So just like with inputs, we use this observation both prospectively and retrospectively. If the program isn't out of the box and I lay out these moderators and I say, boy, oh boy, a couple of these are really going to be killer assumptions, it tells me right now, just like it told me before with relationships, why would I bother with this program? I can't get anywhere past referring for cleanup, anywhere past referring for medical treatment, and I might even lose half the kids I screen because their moms and dads won't stay around for the confirmatory venous blood draw. What actions can I take that will mitigate those moderators? In which case, they're not moderating factors anymore. They come up into the model as very, very strong outcomes that drive my program down to reducing elevated blood leads. Again, retrospectively, as an evaluator, I'm listening to this discussion, and what I'm hearing is three more evaluation-focused questions. Was the hazard politics aligned in a supportive direction? Was the insurance climate supportive enough that you could find people to take on the kids we identified? And were we able to procure that very, very rapid technology for assessing kids such that we didn't lose a whole bunch of people between the initial and the confirmatory screen? So as with everything we're talking about, there's a prospective and a retrospective reason for doing this, and that's what makes logic models so successful in this CPI or CQI space. It helps us prospectively and immediately in a process use way identify ways to make our program better by redesigning it or doing workarounds in the case of inputs and moderators. Retrospectively, as evaluators, we run toward the killer assumption. Even if I haven't had that prospective opportunity to make those changes, I know that what's going to sink this program are these inputs and these secular factors we call moderators that might get in the way. And so I'm going to measure those so that I know if the program doesn't work, I have something to say to stakeholders, funders, and other people that matter. I did the world's best job on this program. Look at all those outputs. I didn't pay attention or I couldn't conquer this outside factor. I'm on the case. I'm going to do it next time, or I can't conquer this. It's not worth trying to solve this problem at this time in this community. So in closing, what were our takeaways? It's never about the model. It's never about what the model looks like. It's about understanding your program. And sometimes that can be in a circle. Sometimes it can be 5 boxes. Sometimes it can be 15 boxes. Sometimes it has all kinds of arrows. Sometimes it doesn't. Number 2, most and the best benefits may be process use benefits. Getting people on board about evaluation often is enhanced by showing them how these early things that happen in an evaluation program, a evaluation process, actually benefit them with immediate process use insights they can initiate and implement immediately. Number 3, Logic models help us cut to the chase on the underlying logic of our program, especially in cases where we have many, many competing definitions of the program floating around. Number 4, almost all the benefits of logic modeling come early in the game from very, very simple logic models. It doesn't mean that there's no utility to elaborating the logic model, including terms like inputs and outputs and mediators and moderators. I just showed you how much more benefit that can be. But a lot of the value of logic models, sphere of influence, sphere of control, what's my accountable outcome, comes from these very, very simple logic models, and you then don't risk losing people to logic model fatigue. And number 5, form always follows function. How accurate does the logic model need to be? It depends upon who's using it and for what purposes. It's not very long between the model before the model gets too complex or complicated to generate the kind of discussion or communication or consensus building that you're trying to do when you've developed the model. Next steps, if this has piqued your interest, we have a companion webinar that looks very much like this but hones in on how to use this modeling and road mapping approach for strategizing and strategic planning, and that's on our website. We've turned this class and the companion class into a CDCU practicum, and we'll be offering that several times in calendar year 17. Just go to the CDCU Learning Portal to find it. We're developing a self-guided manual for people that don't have time for an all-day practicum but need something a little bit more than a 90-minute webinar. And then on any of these issues that we talked about today, we're always available for more information. Just contact myself, my deputy Dan Kidder, or go to our websites, both the intranet website and the internet website. And you'll see these webinars and you'll see a host of other resources that will help you answer these kinds of questions. Thank you very much for your time and attention, and we hope that this was useful.